All right, this is Dr. Shetlin, and I am here this morning with Dr. Bautista at the Immunity Therapy Center in Tijuana, Mexico. He's an amazing medical physician who has been treating cancer for 20 plus years now, if I understand right.
Yeah, 25 plus, yeah.
And the neat thing that with what he's going to share with us today is letting us know there's more options out there than sometimes we realize. Sometimes we're told you only have one choice to try to fight cancer. And so today we're going to talk about some natural choices and get a little bit of an understanding about chemotherapy and clean chemo we'll talk about in a minute. But Dr. Bautista, would you take just a few minutes to explain your background and what got you into what you do so passionately?
Well, I graduated from State University here in Baja California. When I was during my final year of medical school, my social service year, if I remember correctly, because here in Mexico, you have to do a social service year, like kind of to pay the government for your school at the very end of when you graduate, the next year you work for a government agency. During that year, unfortunately, Jay, my father was diagnosed with lung cancer. And it was a small cell, and he actually had a seizure. So when we found out that he had cancer, unfortunately, the cancer was already in the brain.
I see.
Back then I was basically in this medical school, and I rely on some teachers and friends, to help me make decisions along with my family. So we did know better, and we went through the radiation and the chemo, the full dose chemo. And from being a strong, man in his late 50s, he became nothing in 3 months. He went from being a normal function person to nothing in a matter of 3 months. And it was pretty sad to see that. And it was pretty, so going through that period on my medical education, I started questioning why there are not other options, or that there must be some other way of dealing with this problem. That's when I started, going into trying to get out of the conventional, I'm talking to you about the early 90s. And back then there wasn't too much, available. So I started working at alternative medicine hospitals here in Tijuana. Mm-hmm. I work with many different at many different hospitals. I started gathering information. I tried to educate myself, going and traveling to other countries, to Europe, to Cuba, to places where they were looking back then into these other methods of treatment. And to my surprise, I find out that there are many natural treatments and many non-conventional treatments that sometimes work even better than chemo or radiation, Jay. So that was my main motivation. It was from a personal experience that motivated me to look into other options.
That's powerful, because then the drive is real. It's not just.
Oh yeah.
It's personal.
Yes, definitely. It's personal. It's personal.
Well, that's so we can kind of walk through the the history to bring us to current with what you're doing now to help patients naturally. And the model that we've had so long especially in the U.S., but in other countries, is the chemotherapy. Can you just give us a little bit of the medical background on what is chemotherapy and how is it supposed to work?
Okay, chemotherapy, they are extracted. They're medications. Some of them are extracted for plants. Some of them are synthetic. But the idea behind chemotherapy is to destroy they are called cytotoxics. That means that they're poison to the cancer cells, but unfortunately they're poison also to the healthy cells. That's the main problem with chemo, that they do destroy the cancer cell, but unfortunately in the same process of destroying the cancer cell, it destroys everything, particularly your immune system. And that's one of the main reasons why at the same time you're helping, likely you're placing or putting the body in condition of the cancer to come back, because you are destroying the immune system that it's supposed to protect you from this cancer coming back. So I think that's the main problem with chemotherapy. There's a lot of different chemotherapies. There hasn't been much advance in the 60s. Many of the same medications that they were used in the 60s or developed in the 60s as chemotherapies are still being used. Lately, there's been some other type of medications, but not that many, so
It seems like this hasn't
so
changed much over the years. It's been the same for so long rather than advancing like so many other things around it.
yeah, you try to there we look into the immune system many years ago, Jay. We were probably some of the pioneers on trying to stimulate the immune system against cancer.
Mm-hmm.
Back then, a lot of people, or a lot of the conventional world, uh, basically laugh at us at putting this concept out there.
Mm-hmm.
That knowing that the immune system plays a very important role on defending us against cancer, and the immune system can be manipulated for therapeutic purposes. Back then, it was a concept that was not even think about, not until probably the 2000s, 2010. That's when some conventional medications were started to being researched. I'm talking about different immunotherapies, Keytruda, those kind of things that are very new. Unfortunately, those medications or that type of immunotherapy is not selective. Again, we go into this. Basically, what they do is they take off the brakes from the immune system, and sometimes it works, sometimes it doesn't. But unfortunately, the risk for having organ damage or having other problems, or side effects it's high with that type of immunotherapy. The type of immunotherapy that we do here is more selective. We're trying to stimulate specific antibodies to be able to detect the specific cancer.
Fantastic.
That's where we use the specific transfer factors. We use these other treatments that we do here, Jane.
Okay, fantastic. Well, I think that is really fascinating to me, Dr. Bautista, that you're a pioneer in this, because even in our medical textbooks that we've been using for generations, Guyton's medical textbook says we're all generating 10,000 cancer cells per day, and it's the
Mm-hmm.
direct responsibility of our immune system, a healthy immune system, to recognize those as non-self and take care of it. So rather
Yes.
than trying to toxify the body, the cancer cells, and our own cells, you're trying to actually stimulate the immune system to do its job it's supposed to be doing anyway.
Specifically, you want to do it very specifically. That the cancer has a defense mechanism. The cancer will become invisible to the immune system.
Mm-hmm.
The cancer there's already electronic images where actually you can see the big tumor on one side, and then you see the blood circulation, and you see the white cells just going through, not recognizing that the cancer is there. What we try to do, and we've been successful at doing it, is we try to stimulate or to make sure that that white cell, specifically monocytes and killer cells,
Hmm.
that are able to recognize that tumor, to go after it. Mhm.
The cancer's cruising in the patient's body and, for lack of another definition, stealth mode, where the immune system isn't seeing it. How are you stimulating the immune system to then recognize those?
Well, there's different ways that we try to do it, different avenues. Okay, there's ways like for specific transfer factors where you use transfer factors from another person, another immune system that you expose the antigen to
Okay.
develop antibodies. There's dendritic cells. There is macrophage activating factors. There's different ways that we can do at the same time in a program put together where we try to stimulate the immune system to detect the cancer. At the same time, Jay, let me comment something about some other treatments that we do here. There's two treatments that we do. It's called IPT or DPT. Okay, IPT stands for insulin potentiation therapy, and the other one is DMSO potentiation therapy. Okay, sometimes in this treatment we use high doses of B17, which is from the apricot seed that is very useful in many cancers.
Oh,
But sometimes also we use 5 to 10% low doses of
okay.
chemotherapy agents. Let me explain why. First of all, majority of the times we do what is called a chemosensitivity test, Jay.
Mhm.
We try to find out which medications might be more beneficial for specifically for a patient. Sometimes we find that in a breast cancer patients, the medications that work the best are medications that are used for stomach cancer sometimes, so that's a difference between the conventional chemo and what we do here. We try to be very specific. We use micro doses of chemo or metronomic doses of chemo, and we target the cancer. That's the main difference, that we don't allow that medications to go and affect the rest of the body. Okay? We do it with these two techniques. IPT or insulin potentiation therapy it's a therapy where we talk already about, or I don't know if we talk about cancer feeds on sugar.
Mhm.
Cancer it's an anaerobic cell. That means that the main energy source come from glucose,
Okay.
not from oxygen. A normal cell will get the main energy source is from oxygen.
Mhm.
In a cancer cell, is from glucose. So what we do is we know that the cancer cells have a lot of glucose receptors, right?
Right.
So what we try to do is we lower the glucose to a point where it's a hypoglycemia level.
Mhm.
At this level, cancer cells will open up the glucose receptors.
Mhm.
They want to feed, they want to eat.
Yeah.
So and then what we do next, we put a medication that in combination with glucose solution, whatever we found, either B17 or 5 to 10% strength of chemotherapy agent, we put it there together, and then we put it intravenously, and then the cancer will pull the medication, the glucose, along with the medication inside the cancer cell. Okay?
Really? Okay.
Now, the downside to IPT is the hypoglycemia.
Mhm.
You know, the induced hypoglycemia sometimes can make patients not feel well. When you don't eat for a long period of time, then you go into a situation of hypoglycemia. Trying to overcome that, we are using DPT. It's DMSO potentiation therapy, where DMSO, without the need of causing a hypoglycemia, it will have affinity for cancer cell, and DMSO is a really good transporter to cancer site. Okay,
Okay.
so we do the DPT or DMSO potentiation therapy, where we use DMSO to carry and to penetrate selectively into the cancer cell, Jane.
Brilliant. Okay. Well, I want to
Mm-hmm.
just pause for a second for our listeners and point out a couple of things that we've just talked about in the last few minutes that are powerfully different that you're doing. One, rather than using a blanket one size fits all treatment, you're customizing this per patient. You're testing them. And I know from talking to you in the past and visiting the clinic with Shannon that you're doing multiple blood tests rather than a single blood test marker to find out what's going on.
Yes, of course.
You're
Mm-hmm.
customizing it for the patient. You're using vitamin B17, which is extracted from, did you say the apricot seeds?
The apricot seeds, yeah. Another name for B17, so people can identify more, it's called amygdalin, or before that, it was called laetrile.
Okay, thank you.
Mm-hmm. It's not per se a vitamin, but for legal purposes, I think they give it that name.
Yeah, they give it that name. And the tough thing is it's not legal in the US because, and sadly, it's such a competitive factor against big pharma that they've lobbied and passed that it's not legal in the US, which is sad. So I'm glad you're able to use that in your clinic. And then what's beautiful is you're using, and Shannon and I, for lack of a better term, call it clean chemo, where you're taking low doses of chemo, but it's targeted to the cancer cells that that patient has because you've done the testing to find out how their cancer cells are going to respond. And they go straight to the cancer cells instead of that global negative effect in their body, making them so sick and having so many side effects. I just
Exactly.
thought to you for pioneering this. Brilliant.
Well, yeah, definitely. We've been one of the first ones that started doing this treatment. And as you know, Jay, we do many more other treatments around it, many more alternative therapies that we do here as well.
Can you share just a couple of, I'm sure there's no favorite tool in your toolbox because they all are custom for what your patients need, but what are some of the other natural things you're doing to boost the immune system and help fight cancer from a natural angle?
Well, to boost the immune system, well, the nutritional part is really important. The detoxification is really important, to do a very specific detox for heavy metals and chemicals, which can not allow your immune system to respond strongly and specifically against the cancer. But we do treatments that are going to stimulate specifically the immune system, like the RIFE therapy,
RIFE therapy?
RIFE. We use, for example, Halo therapy as well. So we use a series of treatments that are directed at the immune system to stimulate specifically against the cancer. Other form, yeah, go ahead.
To say, because you're doing the vitamin B17 injections, it's not really a vitamin, that's what we call it. You're doing high doses of other vitamins that are helpful to the immune system?
We do, for example, yeah, definitely. Well, we do the high dose vitamin C, as you know, in combination with K3. We use many other IVs that are going to stimulate the immune system. Artemisinin, carnivora, all of those intravenous solutions are going to stimulate the immune system, specifically against the cancer. We use other treatments in combination with these therapies. For example, whole body hyperthermia, which it's a way also of destroying cancer cells, because cancer cells will not tolerate temperatures above 104. So we put patients in a chamber or device under control, in a controlled environment, meaning that we check your vital signs often. And we raise the body temperature to around 104. The intention of that is to destroy cancer cells, yes, but also that's going to produce a strong immune response against the cancer, okay? As when you have a fever, as consequence of an infection, it's our defense mechanism to destroy the viruses or bacteria that are in our body. whole body hyperthermia also will induce this response if we maintain that temperature for around, let's say, 30 to 45 minutes.
Mm-hmm.
Definitely it's something that is going to be a strong immune response.
Fantastic.
By the way, that's something that can be used also with this viral situation also. Hyperthermia can be useful.
Oh, fantastic.
Mm-hmm.
That's good. No, so for those listening, he's talking about the COVID and other viruses, that this hyperthermia is a good technique for that as well. Now, since the cancer cells, as you're mentioning, this is really neat. I'm seeing you're saying they don't thrive in a high oxygenated state. They thrive on sugar more than oxygen for their fuel. And
They're anaerobic completely.
Yeah.
Mm-hmm.
So then I've heard something about ozone therapy, which I think you do, or hyperbaric therapy is also.
Yeah, those are oxygen treatments. Definitely, you want to. That's part of our protocol here, Jay. Ozone therapy. We've been doing that for a long time. The objective of doing that is to overflow the body with oxygen, because as we spoke, cancer cells do not like rich oxygen environment. They are not able to grow. Actually, oxygen treatment, and there are books written about oxygen therapy in cancer. Basically, it's lethal for cancer cells, oxygen. So you want to use as many forms and ways of overflowing the body with oxygen.
Mm-hmm.
There's different ways of doing it. There is the ozone therapy, where we do the ultraviolet blood irradiation treatment, where we take blood out and we expose that blood to an ultraviolet light.
Mm-hmm.
That's going to produce the ozone.
Oh, wow.
There's a hydrogen peroxide intravenously. There is ozone insufflations rectally, for example. There's different ways that we can put oxygen. Hyperbaric is one of them. Um, that is probably the one that could cause a little bit of discomfort. I'm certified on hyperbaric medicine. I studied this. I specialized myself some years ago on hyperbarics. The problem is that you need like 2.3 atmospheres of pressure to really shove that oxygen into the tissues. And sometimes with patients, cancer patients that have problems with lung metastases or brain metastases, is risky. Sometimes that could be risky. So you want to choose the maximum benefit with the less risk oxygen treatments. That's why here we mostly do hydrogen peroxide intravenous, ozone therapy, things like that, Jay.
That makes perfect sense, because if somebody does have a lung problem, I guess like lung cancer or even COPD or something, it's a contraindication for hyperbaric.
Exactly.
That makes sense, because wow, I'm just so impressed with what you've done, how you've really, you just really help assist the body to help itself naturally, and only use toxins in the most focused level to.
Yes.
That's awesome. So, and this isn't to make light of this, so I hope the listeners are take this in the right tone. But what's fascinating to me about your clinic, it's almost like at the gym they have circuit training, where you spend a certain amount of time on different machines. It's almost like circuit training for your immune system at your office. I love how I go in there and I see the patients and they're smiling and they're happy. Their quality of life is improving day by day, rather than being struggling day by day or getting worse. And they're just doing circuit training on these different therapies that you've come up with that help the immune system fight cancer naturally. I just love
Exactly. And some of them, Jay, will actually destroy cancer directly. Like Rife, we can put frequencies specific against each cancer. The DPT that we're talking about. So it's a combination of teaching your immune system to recognize the cancer, at the same time destroying cancer cells, and at the same time making sure that we leave detoxification pathways open, because also we know that we have to get rid of that material that is being destroyed, because also that's not good to stay in your body, because that's also another thing that can suppress your immune response.
Fantastic. Great. Well, I know you're a busy doctor, and I don't want to take too much of your time keeping you from your patients. I am going to put on this video the contact information for the clinic and let them know that if they have further questions, they can reach out to Gaston to
Yes.
talk about how to find out more about the clinic, see if it's a fit for them or one of their loved ones that may be struggling with cancer. Is there any closing comments that you'd like to make?
No, that we're here, and it's very good that I want to emphasize that this is more of a personal journey that I have more than anything else,
Mm-hmm.
trying to offer a different option, to what the conventional side is,
Yeah.
and give hope to people. There's people that come to us in very dire circumstances, in a stage 4, very
Mm-hmm.
very bad, and they were able to overcome the cancer. There's many testimonials, and if you want to look, our website is immunitytherapycenter.com, and all the testimonials are there. And just, when you're facing a situation like this, it is you are bombarded with bad news, at the beginning, and just take the time to research this, to keep your mind open, and knowing that there is hope, and there's light at the end of the tunnel.
Okay, fantastic. I think
Mm-hmm.
that's such an important angle that you give, that you do offer hope, because there's so much despair once people hear the bad news, and some people throw in the towel psychologically, and if they throw in the towel psychologically and emotionally, physically it's hard to make a change. So I really
Exactly, Jay.
all right. Well, thanks for spending some time with us today, and just really appreciate your time today.
Well, thank you, Jay, and see you soon.
Okay.
Thank you.